Good morning, everyone. Coming to you live from the OTA storage room. As promised, we're going to be flipping this lecture to allow more time in class to review for our finals. So today we're going to cover what's referred to as the Occupational Therapy Intervention Process Model. It's also referred to as OTIPM or OTIPM. So our objectives today is we want to describe the steps of the OT process. So this should be a review. Explain the purpose of the OTIPM. Differentiate between bottom-up and top-down approaches to intervention. We also want to differentiate between what are ADLs and what are IADLs. Name the two most reliable forms of ADL, IADL assessments and explain why they're the most effective and reliable. Name common formalized ADL and IADL assessments used in OT, and then describe significant collaborative relationships, consultative partnerships, and process in ADL and IADL interventions. We also want to name performance skills typically addressed in ADL and IADL interventions. We want to differentiate between remedial, rehabilitative, and compensatory intervention approaches, which we talked about earlier in class. We want to explain how the following are incorporated in the OTIPM: client-centered approaches, the FIM and other assessments, remedial and compensatory intervention strategies, as well as collaborative relationships and processes. We also want to associate the steps of the OT process with steps of the OTIPM. So a lot of this is going to sound very repetitive. So steps of the OT process, again, this should be a review. So we have what's referred to as a screening. This is going to determine the client's appropriateness for OT services. After they've been screened, they then go through an evaluation process, which includes assessments, observations, and chart reviews. This is typically done by the OTR. The OTA can help with assessments depending on service competency. We then have intervention. So that's intervention planning. So planning the intervention, actually completing the intervention, and then reviewing the intervention to see if anything needs to be changed. The last thing is the outcomes, and that's determining if they need to transition services or if there needs to be a discontinuation of services, or also referred to as a discharge. And remember, discharge is not a bad word. We should be trying our best to discharge our clients too. Okay, so then we have the OT process and the OTPF. So when it comes to referring to the OT process is the OTPF process. They're one and the same. Within the screening and evaluation, that is the evaluation portion of the OTPF. The intervention planning, intervention, and intervention review are part of the intervention section in the OTPF. And then your transition services, discontinuation of services, or discharge is your target outcome that is in your OTPF or labeled in your OTPF. This is a great little flow chart as far as the different phases of that. So you have your evaluation and goal setting phase, which are all in blue. So this could be helpful when you're studying or when you're looking over this to maybe have a highlighter. So have a blue, green, and purple highlighter. So that blue is going to be the evaluation and goal setting phase. That green is going to be your intervention phase. So kind of like what we as OTAs will do. A lot of what we do is interventions for our clients. And then that purple is a reevaluation phase. So are progress reports, are they meeting their goals or not meeting their goals? And then it's going to be a cyclical fashion. So we're going to go from evaluation, goal setting to intervention to reevaluation, and then back to intervention and reevaluation until discharge, or until we're comfortable with our clients being discharged. So what is the OT-IPM or the OTIPM? So it's a framework that unites the philosophical roots of OT with actual processes. It's a guide to professional reasoning. By following the OTIPM, OT practitioners gain a basis for clinical reasoning. When we talk about clinical reasoning, we're looking at this is going to ensure the accurate selection and application of not only the evaluations, but the interventions and outcomes. So kind of the reason why, the rationale why we choose what we do with our specific clientele. And this is something that you guys will continue to learn through your time here at PIMA. This is a model, this is a model that's used as a structure for integrating occupation as a therapeutic tool used in the OTPF process. So again, just to reiterate, we are very occupation focused, hence our name, occupational therapy. So anytime we can integrate occupations into our clients, that is an opportunity that we have to take. Its purpose, so OTIPM's purpose. So by following the OTIPM, OT practitioners should be able to establish a client-centered context. So again, everything we should do should be involving or centralizing around the client. We should be looking at assessing the occupational performance of them, of our patients. So what are they struggling with occupation-wise? What are they doing well in occupation-wise? It's also going to determine our appropriate interventions based on the client's context. So, as we mentioned in class, or as we'll talk about in class, we're determining if we're selecting a remediation approach or a compensatory approach. And it's also going to help us determine follow-up interventions too. So, if we've met this goal, what is the next thing that we should do with our client? When it comes to approaches to intervention, there's going to be two different approaches we're going to talk about. There's the bottom-up approach and the top-down approach. So when we think about the bottom-up approach, it's more so impairment based. So we're looking at what that patient is impaired with. We're going to be utilizing restorative or remedial strategies. The goals are addressing the level of impairment. So they aim to improve those functional skills that that specific client is dealing with. And it focuses on the deficits or the cause of those deficits. So this is more of a deficits-based approach. The assumption is that the acquisition or restoration of motor, cognitive, and other skills will result in successful performance. So we're trying to acquire or restore a lack of motor, a lack of cognition, or other skills to help get our clients successful with what they're working on, which is typically their occupations. So there's advantages and disadvantages to all of them. Biggest advantage is they can apply to all patients. So once you've worked with a CVA patient, you have a better idea as far as like, okay, these are the strategies that work best for that CVA patient. Same thing with an autism spectrum disorder patient. You may, like I mentioned in class, while all individuals that are on the spectrum are like definitely different, there are definitely some sort of similarities, and you can utilize those similarities for specific treatment approaches. Many clinics will use the biomechanic or biomedical approach. It's good for collecting and tracking data. So when you use the bottom-up approach, you're good. It's good. It's good about collecting numbers and seeing trajectories as far as like, okay, this intervention treatment works because of X, Y, and Z, or I know this works because I've seen this happen with previous patients. It's also good for time-sensitive interventions. So individuals that have TBIs or a stroke, it's super important for us as practitioners to see those patients ASAP, right after the injury, obviously after they're stabilized, to help them gain the skills that they need. Some of the disadvantages is its objective is to obtain function, and independence in occupation is not at the forefront. So we're just solely looking at, okay, how can we have this patient function and not necessarily have them function for an occupation in mind. So again, kind of leads me to that second point. It can be seen as very mechanistic. So kind of seem like like you're doing a route thing. So you're just constantly seeing these patients doing these route exercises without like an occupation in mind, so to speak. We then have the top down approach. This one's very function based. It's dealing with compensatory strategies as well as adaptation strategies. With this, we're maximizing the existing skills and adapting their activities based on those. And we're focusing on skills necessary to participate in their daily activities, so those occupations. The assumption that we're having with a top-down approach clientele is understanding the client's role in context will determine important tasks and skills needed to accomplish them. So we are doing more so of, okay, let me ask this patient what their roles are at home. Are they a homemaker? Are they a father, a mother, a brother, a sister, etc.? And then taking those and figuring out what's important to the client. Some advantages is it's occupation based, which is great. That's what we're looking for. It's more consistent with the principles in which OT was founded. It's holistic. So we're seeing the person, as a full person. And the intervention can be applied to those who display occupational limitations, but not necessarily medical diagnoses. So not necessarily looking at underlying conditions, but okay, they want to reach maximum potential with this occupation. How can we provide that for them? Disadvantages is assessments may not always be objective. as well as models not always applicable in all treatment settings. So basically, if you're working on a specific occupation in a certain setting, you may not have the availability to work on that other occupation in a different setting. So then we have establishing the client-centered performance context. So its purpose is it provides the basis for understanding the client's roles in occupational performance. It helps with establishing rapport of your client. I will get on my soapbox. I think rapport is the most important thing for us as OTPs. You get a lot done with a person or a patient that physically and actively trusts you, and that's why rapport is so important. You can also see on page 563 of Uniting Practice and Theory in the Occupational Therapy Practice Framework. That is linked in your course content if you wish to look through that. More establishing the client-centered performance context. So we have components of the client-centered performance context that can be found in your OTPF that you have. That's including your client report. So why they're seeking services, what are they successful occupation-wise, personal interests and values, occupational history, performance patterns, etc. We then have our environmental context. Those are your physical context, so buildings, furniture, etc. Your social context is your family and friends, pets, etc. We can also look at cultural context, personal context, temporal, etc. We're also looking at the client's goals. So, what are the client's priorities and desired outcomes with therapy services? In pages 514 and 516 of Uniting the Practice, linked in your course content, Fisher specifies multiple dimensions and methods that help define and establish a client-centered performance. So kind of like a framework for client-centeredness. As far as the methods, so methods we can utilize are chart reviews. So we can always look at the patient's chart. Observation is going to be key. OTPs are keen on their observation skills and utilization of observations. We also have structured interviews, so the occupational performance history interview, as well as the Canadian Occupational Performance Measure, the COPM. These will be discussed in your second semester classes a little bit more in detail, but these are ways of structuring interviews for our patients or for our patients' families. Then we have identifying strengths and problems of performance. So we're looking at ADL and IADL assessments. So we have ADLs, which are also called BADLs, which are basic activities of daily living. These are activities involving yourself, so bathing, dressing, etc. Then you have your IADLs, which are activities involving the self in relation to the environment. So these are your money management skills, your child care, community mobility, etc. And those are in your OTPF. We then have most effective methods. So there's a lot of reasonings that are in your Ryan text on page 445. We have observation. So again, observation is going to be highly important in our field, in our practice area. We are also looking at the actual client task performance. These are a list of assessment tools that you guys could potentially be utilizing in practice. I believe, if I'm not mistaken, you guys will cover a lot of these in your second and third semester classes. So don't feel like you need to memorize all of them. These are just an idea of like what those might look like. Then we're going to clarify and interpret the cause. So these are typically based on the patient's diagnoses. It could be some anatomical, physiological, neurological, or psychosocial theories as far as like what's going on with the client. We're also looking at the client's history. Client's history can also lead to some answers as well. This may require further evaluation of underlying neurological, musculoskeletal, cognitive, psychosocial, or environmental factors. And then we're also looking at overall role delineation. So this step requires a theoretical background, so is an OT role. OTA can contribute input of observation or areas in which service competency has been established. So we're kind of trying to figure out what are their roles, but we're also looking at our roles too. Like what is it delineating from a role of an OTR versus an OTA? We then have a treatment approaches and planning, so that planning and intervention and ADL evaluation. So we're looking at multiple treatment approaches can be used during treatment planning and intervention stages. So what you guys will eventually learn throughout your time here at Pima is that you don't need an intervention or treatment session. Doesn't need to just be one thing. It can be multiple things. It can also be one activity to target multiple different goals of the patient. Your two strategies are going to be remedial or remediation, which is improving in the client's condition can be expected. You're restoring the anatomical, physiological, neurological, or psychological capacities. We also have compensatory or adaptation, which your client's condition is not expected to improve or the client requires temporary adaptation during the recovery process. We're also looking at your perception of independence related to an ADL may not be the same as others. So, as I mentioned too, like the idea of independence doesn't mean that you're doing the tasks significantly faster than other. One person's independence in cooking, cleaning, etc., could be completely different than another person's. So this is where collaboration with a client is the first priority in treatment planning and overall intervention planning. And then we have reevaluation for enhanced occupational performance. So we're repeating performance analysis. So we're continuing to repeat. If we're doing a test battery or an assessment battery, we're continuing to utilize that to get tangible data of how that patient's progressing. We're redefining effective and ineffective performance. So we're figuring out, okay, this was effective for my patient, this wasn't as effective. And then we're determining next steps. So should they continue the intervention with appropriate modifications and grading of activities? Should we establish a transitional care or continuation of care? Or should we discontinue the services completely? So again, here's that lovely image as far as a cyclical fashion. So we have that evaluation and goal setting phase, immediately to the intervention phase, and then to the reevaluation phase. And it's very cyclical in how it works. So it goes evaluation, goal, intervention, and then reevaluation. So putting this all together, so OT process, the OTPF, and the OTIPM. So again, the OT process is the OTPF process. They're one and the same. It's the same thing. Screening and evaluation is the evaluation of the OTPF, and that's what is establishing the client-centered performance context in the OTIPM. It's basically another way of phrasing it in three different ways. Then we have the intervention planning, the intervention, and the intervention review. That is the intervention in the OTPF, and that's the selection of remedial or compensatory top-down or bottom-up strategies in your OTIPM. Then we have transition services, discontinuation, and discharge. That is your target outcomes in your OTPF. And then that is your reevaluation for enhanced and satisfying occupational performance within your OTIPM. Here's a review of today's objectives and my references. Okay, so plan is once you guys review that, I will plan to have a review on the OTIPM, just kind of like terminology and stuff like that. That will be important for your final exam to cover in class. We'll cover that, do some review, go over those questions, and then hit the next set of content. And then we should have enough time in that class to review for your final exam. As always, feel free to reach out to me if you have any questions. If not, I will see you in class.